Picture this. You wake up on a Tuesday morning and discover that one of Canada's wealthiest provinces just made a decision that could literally put lives at risk. I'm not talking about a natural disaster or an industrial accident. I'm talking about a political decision that has Alberta's doctors, nurses, and healthcare professionals up in arms, warning that patients could die because of a vaccine fee. That's right, a fee that might seem small on paper, but according to the province's own doctors, could be the difference between life and death for thousands of Canadians. And the most shocking part? This is happening right now while you're watching this video. Before we continue, if you want to stay informed about the most impactful news from Canada and understand what's really happening behind the scenes of Canadian politics, don't forget to subscribe to the channel and hit that like button. Comment below what you think about this Alberta situation, because your opinions are crucial for understanding the public pulse on these decisions that affect all of us. Premier Danielle Smith's government announced last Friday a change that's causing a real earthquake in Alberta's healthcare system. Residents who are not immunocompromised or on social programs will soon have to pay to get the COVID-19 vaccine. Sounds simple, right? But look at the real dimension of this decision. The government said it hasn't been determined how much Albertans would pay, but an estimated cost to procure each shot is $110. 110 Canadian dollars. For many families, that's a week's grocery budget. For a minimum wage worker, that's almost 8 hours of work. For a senior on a fixed pension, that could mean choosing between medication and protection against a virus that has already killed millions worldwide. But here's where it gets really concerning. The Alberta Medical Association isn't just expressing concern. They're sounding the alarm bells. Healthcare unions and doctors are calling on the province to reverse course and provide free COVID-19 vaccines to all frontline workers and any other Albertan who wants the shot. Think about that for a moment. These are the people on the front lines, the ones who've seen the worst of this pandemic, and they're warning that this decision could cost lives. Let's break down what's really happening here. The government claims this decision is about reducing waste. Premier Smith stated that $135 million got flushed down the drain last year, with doses wasted partly because of over-ordering. But here's the question nobody's asking. Is the potential cost in human lives worth the savings in government spending? The province has ordered just under 500,000 of the vaccines for the fall, or about 1/3 of what was ordered last season, at an estimated cost of $49 million. That's a massive reduction. We're talking about cutting vaccine availability by 2/3. In a province with over 4.7 million people, that's approximately 1 dose for every 10 residents. The math is staggering. Now let's talk about who this really affects. The government says immunocompromised individuals and those on social programs will still receive free vaccines. But what about the middle class? What about working families already struggling with inflation, rising housing costs, and the general cost of living crisis that's hitting Canada hard? These are the people who fall through the cracks, too well off to qualify for social programs, but not wealthy enough to casually spend $110 on a vaccine without thinking twice. Healthcare workers are particularly outraged, and rightfully so. They said staff should not be expected to put themselves in harm's way without protection, and said barriers to vaccination will put patients and the healthcare system at risk. These are the heroes who worked through the worst of the pandemic, who put their lives on the line to save others, and now they're being asked to pay out of pocket for their own protection. The timing of this announcement is also suspicious. Released on a Friday afternoon, the classic time for governments to announce unpopular decisions when they think fewer people are paying attention. It's almost like they knew this would cause a massive backlash and tried to bury it in the news cycle. But Alberta's medical community wasn't having it. What's particularly troubling is the broader context. Alberta has been positioning itself as a province that questions federal health policies, sometimes taking stands that put it at odds with national health recommendations. This vaccine fee decision fits into that pattern, but at what cost? When medical professionals are warning about lives being at risk, shouldn't that override political positioning? Let's examine the economics of this decision more closely. The government claims it will save money by reducing waste, but what about the hidden costs? What happens when people can't afford the vaccine, get sick and end up in the hospital? Emergency room visits, intensive care stays, long-term health complications, these costs dwarf the price of a vaccine. It's classic penny-wise, pound-foolish. Thinking, the ripple effects of this decision could be enormous. Other provinces might look at Alberta's move and consider similar measures. If this becomes a trend across Canada, we could see a return to a two-tiered healthcare system where your ability to protect yourself from disease depends on your wallet size. That's not the Canada most people believe in. What's also concerning is the message this sends to vulnerable populations. If you're elderly but not quite poor enough to qualify for assistance, if you're a healthcare worker earning a modest salary, if you're a teacher or retail worker constantly exposed to the public, the government is essentially saying your health is worth less than the cost of reducing vaccine waste. The Alberta Medical Association's response has been swift and unequivocal. Medical professionals don't usually get involved in political battles unless they believe lives are genuinely at stake. When doctors collectively raise their voices like this, it's time to pay attention. These are people who've spent years studying public health, who understand the science behind vaccination programs, and who see the real-world consequences of policy decisions every day. The international implications are also worth considering. Canada has positioned itself as a global leader in public health, particularly during the pandemic. How does it look to the international community when one of the country's wealthiest provinces starts charging citizens for pandemic protection? It undermines Canada's credibility and could impact our relationships with international health organizations. From a public health perspective, this decision is particularly puzzling. Vaccination programs work best when they achieve high coverage rates across the population. Creating financial barriers to vaccination doesn't just affect individuals, it affects the entire community's immunity. When fewer people are vaccinated, everyone becomes more vulnerable, including those who can't be vaccinated due to medical conditions. The government's argument about waste reduction, while valid on the surface, ignores the broader picture. Yes, throwing away unused vaccines is wasteful. But isn't it more wasteful to have people die from preventable diseases? Isn't it more wasteful to overwhelm the healthcare system with patients who could have been protected? The cost-benefit analysis seems to be missing some crucial variables. What makes this situation even more infuriating is the timing. We're in June 2025 and we're still dealing with COVID-19. The virus hasn't disappeared, variants continue to emerge, and healthcare systems are still under strain. This isn't the time to be creating barriers to vaccination. This is the time to be making it as easy as possible for people to protect themselves and their communities. The social justice implications are also stark. This decision essentially creates a class system for healthcare protection. Those who can afford $110 get protected, those who can't take their chances. In a country that prides itself on universal healthcare, this feels like a betrayal of fundamental Canadian values. Looking at the numbers again, let's put this in perspective. The estimated cost of $49 million for 500,000 vaccines might sound like a lot, but Alberta's total budget is over $70 billion annually. We're talking about less than 0.1% of the provincial budget. The government spends more on some individual infrastructure projects than they would on providing free vaccines to all Albertans. The healthcare workers' concerns go beyond just their own protection. They're worried about their ability to provide safe care to patients if healthcare workers can't afford vaccination, or if they become sick because they couldn't get vaccinated. Who suffers? The patients. The very people the healthcare system is supposed to protect. What's particularly galling is that this decision comes at a time when Alberta is reporting budget surpluses. The province has been benefiting from high oil prices and economic growth, yet they're choosing to nickel and dime people on something as basic as pandemic protection. It's hard to understand the logic behind this prioritization. The precedent this sets is dangerous. If governments can start charging for pandemic vaccines, what's next? Fees for flu shots? Charges for childhood immunizations? The slippery slope is real, and it leads to a place where healthcare becomes a luxury good rather than a fundamental right. As this story continues to develop, one thing is clear: Alberta's medical community isn't backing down. They've seen what happens when people can't access healthcare protection, and they're not willing to let political considerations override. public health needs. The question now is whether the government will listen to the experts or continue down a path that could have serious consequences for public health. The next few weeks will be crucial. Will the government respond to the medical community's concerns? Will other provinces follow Alberta's lead? Will the federal government intervene? These are the questions that will determine not just Alberta's healthcare future, but potentially the direction of healthcare policy across Canada. What's certain is that this debate is far from over. When doctors warn that lives are at risk, it's not hyperbole. It's a professional assessment based on years of experience and scientific evidence. The question is whether political considerations will override medical expertise and what that means for the health and safety of Albertans. This situation in Alberta represents a critical moment in Canadian healthcare policy. The decisions made now will have long-lasting implications for how we approach public health, healthcare equity, and the role of government in protecting citizens' health. The medical community has spoken clearly. Now it's time to see if their warnings will be heeded or ignored.